Hi, you're on the Bible Forum. I'm Warren Sprouse. Do you know anything about the Biden health care plan? Joe Biden has published his health care plan. Presumptive Vice President elect Kamala Harris strongly supports the Bernie Sanders single payer Medicare for all health care plan. It's actually got a name, H.R. 1384. It's likely the system they seek to implement will have elements common to both Joe Biden's and this H.R. 1384. Whatever the name of their preferred system, socialized medicine, single payer, universal health care, Medicare for all, the most accurate descriptor will be nationalization, meaning the transfer of a major branch of industry or commerce from private ownership to federal control. Nationalization takes away the right to choose from the individual and puts it in the government's hands. All you have to do is ask the Brits who wait months for basic medical procedures. I had a lady call me on the Bible Forum, about 15 years ago now or so, lived in Canada. They have a similar system. She had been diagnosed with cancer. She had to wait 9 months to see a cancer doctor. She bought a ticket to the United States. She went to Minnesota and saw a doctor when she needed one. That's what national health care is all about. Washington's going to choose your doctor, dictate your care, and spend your money. Because Washington doesn't have any money except what you give it. Private health care policies will cease to exist. Section 202 of the Medicare for All bill prohibits private insurance by law. Biden's plan would create a taxpayer-supported government insurance company called the public option. Lowballing prices, the public option will drive private insurance companies out of the market. But either way, Americans will have only one insurance option, and that's whatever Washington approves. Section 614B of the Medicare for All bill decries capitalism and the profit motive as the reasons for the failure of the U.S. healthcare system in the first place. Capitalism was the key success factor that propelled 13 small colonies to become the world's superpower. Profit motive is the driving force for American innovation. Without it, the medical miracles we now enjoy would not exist. We're talking cancer cures, laparoscopic procedures, non-surgical heart repairs, and the rest of it. And it was profit motive in this private sector that developed vaccines against COVID-19 in less than a year. That was truly warp speed, not possible under government bureaucracy. Nationalism, by definition, includes strict price and wage controls. Payments to providers and drug companies will be reduced by the national health budget. That is central economic control as used in the Soviet Union, in China, in Venezuela, and other totalitarian systems. The effects of wage and price controls have proven, beyond a doubt, that shortages, low quality, insufficient quantity, and ultimately higher costs follow right behind. Charles Blehaus of the Mercatus Center has shown that nationalism will reduce payments to physicians by at least 40%. This will worsen the doctor shortage and lengthen wait times for patients to receive care. Before the Affordable Care Act, the average maximum wait time to see a primary care physician was an unacceptable 100 days. After the implementation of Obamacare, the maximum wait time had increased to an unconscionable 176 days. With nationalization, the wait time could become years, not months. Inordinately, long wait times for care give rise to death by queuing, by by lining up. Such death by queuing has been documented in single-payer systems such as UK's National Health Service and our own VA system, where 47,000 veterans may have died waiting for care. Cost estimates of nationalization range from $32 trillion to more than $40 trillion, the latter projection by Bernie Sanders himself. The cost will be added to what we are currently spending. Biden has assured us that only those making more than $400,000 a year would see higher taxes. And that is just blatant nonsense. Every politician knows the Willie Sutton rule. When asked why he robbed banks, Sutton replied, "Because that's where the money is." Though the hyper-rich make nice targets for class warfare rhetoric, there's too few of them to generate the trillions of dollars necessary for Democrats' health care plan. Such amounts of tax revenue can only come from middle-class Americans. Democrats promise affordable care will suffer the same fate as their promise of $2,500 in savings with Obamacare. Care will be affordable, in fact, at no charge, at point of service, but it will be quite unaffordable when the tax bill comes due, more than double what we're paying now. In fact, the price tag for Democrats' nationalization, $40 trillion, will bankrupt this nation. Even with this massive expenditure, Americans still won't get care in time to save them. In December 29, 2009, author Daniel Putkowski released a novel describing what medical care would be like for the average American if U.S. healthcare were nationalized. In his book, a desperate father had to resort to black market medical care to save his son with a heart condition. The book's title? Universal Coverage. It was subsequently used as the Section 102 header in the Medicare for All bill. For patients, doctors, and our nation as a whole, it is terrifying to think that what Putkowski's fictional dystopia may soon become our own